As it now stands, the public health care system in Jamaica is incapable of dealing with the needs of our population as a whole. We have patients having to sleep on chairs and on benches for days sometimes while they wait to be admitted. We have the very high costs of diagnostic tests, of surgical implants, and of medication where they are not covered by the regions or the Ministry of Health or the National Health Fund. Breakdowns in equipment, from basic things like elevators and air conditioning systems to critical tools like CT scans and MRI machines. Madam Speaker, it's imperative that we have a new direction in healthcare. If our hardworking healthcare workers are going to be able to treat our people effectively, the facilities at public hospitals and health centers must improve. There are 23 Madam Speaker, there are 23 public hospitals in Jamaica, and this doesn't include the University of the West Indies. Under the next PNP government, Madam Speaker, we would have the following priorities in our new direction. We would increase the number of renal dialysis centers with the aim initially of having one at every regional hospital in the country. A national health insurance scheme will be a priority of our next administration. When we last costed it, it was at about 22 billion a year to do. But it is essential to make the difference between treating an illness or waiting to suffer and die because of a lack of resources, which is all too often the case now. A third priority program, Madam Speaker, is the expansion of primary health care across the country. This will involve upgrading health centers, establishing mobile clinics in deep rural areas, and expanding the number of community health aides across the country, deploying them out in the communities. This is particularly needed for the treatment of NCDs and mental health patients island-wide. We need to get the community health aides actually going into the communities. And greater emphasis has to be placed on training and education and retention of healthcare professionals. For nurses, we'll resume the allocation of resources for scholarships and grants to nursing students and expand the number of permanent posts in the health system for nurses. For doctors, following the completion of their internship and a senior house officer 1 position, we will deploy them to serve in Jamaica's rural areas. Incentives will be provided to include scholarships for postgraduate training after a period of service in our rural communities. And we will upgrade all Type B hospitals to offer more clinical specialty services to reduce the burden on the overburdened regional hospital system.